So I'm pleased to inform you today that the unions representing our nearly 800 registered nurses, LPNs, technicians, and technologists ratified the tentative agreement reached between the two parties last week. As ratified, this agreement brings an end to one of the most challenging times in the 100-plus year history of Lawrence Memorial. While both parties have agreed to keep specific details private, there are 4 key elements of this agreement. The first is a global agreement that erases all issues previously before the National Labor Relations Board. Second, we've reached agreement on any issues related to the previous transfer of work from the hospital's former OB clinic and outpatient psychiatric care to physician offices in the community. Third, we've reached agreement on how best to handle any job transfers that may happen before the agreement expires on June 30, 2016. And finally, we've agreed upon a group of core principles regarding the way we will work together in the future. And I think you'll hear about some of those core principles this evening.
Our agreement is not only about new contracts for the nearly 800 caregivers. It resolves all the outstanding issues like Bruce indicated. And we talk in terms of global settlement, we mean just that. All of the pending charges at the National Labor Relations Board, the complaint that had gone to trial for the last, well, for 7 days, those are all resolved. We're bargaining this contract this year. We have the healthcare workers contract the following year, and then we're going to be back in the negotiations again for these 2 units. And we cannot, for the betterment of patient care, always be at one another. We need to think of a better way to move forward because bargaining contracts will continue, and our job is to improve the relationship because after all, we're here to serve the patients and the community. The main objectives of both the hospital and the union have been achieved through this agreement. Now, it's unfortunate we had to take the route that we did, but we chalk it up as a learning experience as well. Because with the changing landscape of healthcare, we need to learn how to adjust on the fly and have both parties' interests in mind. Both the hospital's interest of growing as well as maintaining the services that they provide. And we believe that the hospital's made some really gains at recognizing our desire to also maintain and represent our members.
We should be proud of what we accomplished. We accomplished not only what was important to our membership, but our combined efforts, they result in more than just a collective bargaining agreement. We paved the way to foster an environment of trust, of mutual respect between members and between management alike. We expect this is a start to a true collaborative relationship. We want to benefit our members, we want to benefit management, and most importantly, we want to do what's right for our patients. So again, I want to thank everyone for all of their support at this time. I'm honored that, that my colleagues put their trust in me, and I'm honored that we were able to accomplish what we did, and I look forward to collaborating and to moving forward to a brighter future here at L&M with our membership and with our leadership.
I too am honored by my colleagues to have them lead me to get them exactly where we needed to be, which is in finally a nice collaborative relationship with the hospital. These past few months have been very trying for all of us. It's been definitely difficult, as Bruce said. Nobody's enjoyed it. It's not been fun. But what we're hoping now is that with the core principles that we've fostered a work environment that's free of intimidation and hostility, where everyone is treated with mutual respect, leading towards a much more collaborative relationship. For us, one of the most important things was our patients. And we think now with this collective bargaining agreement that we have that our members are not the only winners, our patients, their families, the community, they can be winners in this. Everybody needs to have a little time, and I think this is exactly what we need to heal and recover to be healthier in the future. This agreement is a renewed commitment by labor and management to the hospital's mission, which is to improve the health of the region. I know that's something that's important to every single employee here, and it's something that we all take very seriously. Our new path forward with working with the administration is vital to preserving the quality of the care in the region, also something that was very important to every single one of us. And we believe that now that the employees have free choice about their future, and they know that that's what counts, It's not dictated to them, and their path can be theirs.
Both parties realized with the mutual benefits of settling this dispute.
We've now come together with the hospital and made one big problem now solved.
Hoping that, cautiously optimistic that this will improve our relationship between the hospital administration, the managers and the directors and the employees and the union, and that we could forge a more positive, mutually beneficial win-win type of relationship, because that's what we're really here for, and hopefully that's what we can do.
That's the biggest piece, to be able to know that you can go to your manager to work on what's happening on the unit or what's going on in the community, to know that we're there, to be back out there to support our patients and to support everyone that has supported us during that time.
Well, the first day of the lockout, Oli and I went to the bank, and we realized we were getting a lot of donations and a lot of support from community, and I had no clue that this was going to happen. We opened a bank account. It's called the AFT Hardship Fund for nurses and techs that need financial help during the lockout, and the outpouring was amazing. We got over $100,000 to help folks in need, and we had people coming in our office crying, and I would take them in the office and I would sit there and cry with them, and we would take care of their financial needs, and that's how we started. I think we purchased more than 3,000 gallons of oil we're up to, and I'm going to purchase some more, and I think we paid like 90 bills for people, and it was just amazing the amount of donations that came from all over the country.
I really think that being together out on the sidewalk really made a difference. We bonded in ways. I've been with the hospital for 25 and a half years, and your friends, your co-workers, but we became a family.
Definitely stronger. I met people on that picket line I didn't even know before, and now it's like they give me hugs down the corridor, and it's just very heartwarming. We all bonded as a group, and we're going to hope it stays that way, and I'm sure it will, because we've gotten a lot of support from community, and people have realized that we're strong and we're the people on the front lines, and we're the ones that take care of the patients.
Immense sense of relief and accomplishment, like a load off of our backs, that this is finally over with and resolved in a hopefully mutually beneficial way to everyone.
But things like mutual respect will be recognized. Either side won't promise certain things, and there will be no coercion or intimidation or threats. And there's a dispute mechanism that's made available that was acceptable to both parties, and we think that those principles are important.
I'm just expecting that my counterparts in HR we're going to work together towards that goal. In fact, I'm going to hold them to that.
So the agreement that we reached, I believe, was an agreement that has met both parties' needs. It was a difficult process, as everyone knows, but as Greg had indicated in an earlier statement, I think both parties have learned some things, and if we can put those into place moving forward and build on that, we have worked together collaboratively in the past, and I believe that we can move forward to there in the future.
I think this deal is what's going to get us back to where we were improving the health of the region, making sure that this hospital was the employer of choice, and making sure that our members were as happy as they could be. So I'm pleased to say that we're back, headed that way.